Is Idaho actually the worst place to retire in the Pacific Northwest? You might think moving your elderly parents closer will solve your caregiving problems, but the data suggests you're walking into a trap. Today, we're exposing the hidden gaps in Idaho's senior infrastructure that are tearing multi-generational households apart. If you don't have a backup plan for professional care, your family's future could be at risk. We're going to talk about the senior care reality here in North Idaho, and we're going to get after it right now. Hey, I'm Reed Wilson with Revealing North Idaho. Idaho resident my whole life, been living here in the North Idaho for the last 10 years and been in the real estate game for the last 20 years. Come at you every week with new information about the North Idaho area. So if you're looking at coming to the North Idaho area and you're needing some additional information or just want to see what's going on here, you're in the right place. So let's talk about the false promise of the Idaho Dream with the senior care reality check here in 2026. We've all seen the brochures, the Idaho Dream, a massive timber framed home on 5 acres, a guest house for grandma and grandpa and the kids running free in the woods. It's the great migration of the 2020s, multi-generational living at its finest. But as we hit here in 2026, that dream is hitting a brutal breaking point. Families are moving from high resource states like California, Washington, Texas, and other places looking for a slower pace of life, only to hit a wall that they never saw coming. Today, we're looking at the false promise. We're going beyond the mountain views to reveal the harsh reality of senior care infrastructure here in North Idaho and why your multi-generational move might be headed for a crisis. Let's talk about the disconnect and care shock. The disconnect is simple but deadly. People move here for family proximity, but they forget that proximity doesn't equal support. In states with high taxes and massive infrastructure, specialized senior services are a given. If you're moving an aging parent with chronic conditions, you're about to experience care shock. That 15-minute drive to a specialist in Seattle or Orange County just turned into a 3-month wait for a primary care doctor in Coeur d'Alene, followed by a white-knuckle drive over to Spokane for a neurologist. The infrastructure just hasn't kept up with the migration. Let's talk numbers. In 2026, North Idaho is facing a severe deficit in licensed skilled nursing beds. While our population has aged rapidly, our facility growth has remained stagnant or even contracted due to staffing shortages. We are seeing a 2-year waiting list for top-tier assisted living. That means if your parents have a fall or a stroke today, there is no plan B. You are in permanent crisis management. And if you're dealing with dementia, the reality is even harsher. Specialized memory care units are at 98% capacity across Kootenai County. This is leaving families to manage advanced stages of Alzheimer's at home without professional training, leading to dangerous situations for both the senior and the adult children. Let's talk about the low cost myth and the wealth trap. Everyone says Idaho is cheaper. That might be true for car registration, but for senior care, it's a myth because we have a shortage of workers. Private pay home health rates in Idaho have actually outpaced the national average. You're paying a premium for a limited pool of caregivers. Let's talk about some pricing for the level of care. Let's say independent living. In Coeur d'Alene, that number runs around $3,200 to $4,800 and up per month. Over in Post Falls, you're around that $2,900 to $4,200 a month. For assisted living in Coeur d'Alene, you're around that $4,500 to $7,500 and up. And assisted living in Post Falls is going to run around that $4,200 to to $6,800 a month. Memory care, Coeur d'Alene, $6,500 to $9,500 a month, and Post Falls is going to be around that $6,000 to $8,500. So we do see that a little bit less expensive in the Post Falls area, and I am seeing that numbers in Rathdrum are falling in between those also. So you're not going to save a lot. You might save up to $1,000 over the Post Falls area. I don't really have numbers on the Spokane area, but that's what we're dealing with here. Then let's talk about the wealth trap, because most North Idaho facilities are moving towards a private pay only model. They may require you to pay $7,000 a month out of pocket for 2 or 3 years before they'll even consider transitioning that resident to Medicaid. If you sold your parents' home to fund the move here, that equity can vanish in less than 36 months, leaving you with no options when the money runs out. Let's talk about the toll on the sandwich generation, and that is those that are raising kids while also caring for parents. When the facility fails to open or the home health nurse calls out for the third time this week, you are the backup. We're seeing a massive impact on local employment, professionals who moved here for remote work that are being forced to leave the workforce and provide 24/7 monitoring for a parent. That dream of grandparents in the guest house, it often turns into a medicalized nightmare where the guest house becomes a mini ICU and the family dynamic erodes under the weight of burnout and physical exhaustion. Strategic realities and solutions. I'm not saying don't move here. I'm saying move here with your eyes wide open. If you're planning a multi-generational move, you need a success strategy. Number one, the medical audit. Before you list your home in another state, call specialists in Coeur d'Alene and Spokane, the surrounding areas. Ask, are you accepting new patients and what is the wait time? If it's 6 months, you need a plan for that gap. Number two, that middle ground search. Look into respite care and adult day programs like those offered by the Area Agency on Aging. These are currently functioning better than full-time facilities and can give you the breathing room that you'll need. Number three, the home modification factor. Don't just look for a house with a guest suite. Look for a home that is already ADA accessible. Retrofitting a home right now can be very expensive, and a lot of the contractors are booked months out. North Idaho is a beautiful place to live, but beauty doesn't provide health care. Don't let the Idaho Dream become a caregiving crisis because you didn't do the math on the infrastructure. Pro tip. If you are scouting for a family member, check if the facility is Medicaid certified. And ask specifically about their Medicaid spend down policy. Many families are blindsided when the facility asks them to move out once their private savings are exhausted. Hey, if you've experienced care shock here in the area, or in moving here, or you have found a solution that works, leave us a comment. Let me know what's going on. We need to start this conversation as a community. Let's get the help we need for our seniors and for our families. Hey, I'm Reed Wilson with Revealing North Idaho. Don't forget to like and subscribe here for my videos. We come at you every week, and like I said, my team and I, we are never too busy for you. We want to help make your move to North Idaho a smooth transition. We'll see you next week on the next video. Thanks for watching.